Hi, I'm Dr. Tesreen Alabai. I'm a naturopathic doctor. I practice in Vancouver and I'm the owner of Vitalia Health Care. So in this short little video, we're going to talk about thyroid and we're going to focus a little bit more on hypothyroidism or low thyroid. So this is actually quite common. I do see a lot of people where they'll mention, they're looking at symptoms of hypothyroidism or low thyroid, and they feel like they're checking off pretty much the symptoms, they're experiencing them, but then they'll go in, they'll get their lab work done, and they say, my labs come back normal. Or I may see another scenario where somebody is already taking thyroid hormone replacement, but they still feel like they're experiencing low thyroid symptoms. So what could be some of the reasons, something to consider, and I want you to think about immune system. So most cases of hypothyroid or low thyroid are actually due to an autoimmune condition known as Hashimoto's thyroid. And not everybody is screened for Hashimoto's. So this is looking at the impact or the effect of the immune system essentially targeting the thyroid gland. And by targeting the thyroid, it affects the production of thyroid hormones. And so we're not really looking at a thyroid condition, we're looking more at an overall immune system condition. And so one of the areas that we are able to test and look for is actually antibodies. So when someone comes in for whether they're experiencing thyroid symptoms or they've been diagnosed with hypothyroid, I really want to look at a little bit more comprehensive testing. So a TSH, a free T4, a free T3. I also want to look at the antibodies, the thyroperoxidase and the thyroglobulin antibodies, and then also measuring something called reverse T3, which gives us information about the transport of thyroid hormone. So we take a comprehensive look at what's going on at the immune system and also what's going on the thyroid level. And so if somebody does come back positive with the antibodies and we are looking at an immune system problem or Hashimoto's, then the treatment is going to be targeted at also balancing the immune system. And this could include dietary suggestions, supplements, liver health, gut health is also important when we're thinking about immune system balancing. So again, looking at thyroid health, taking a whole body approach and looking at possibly if the immune system is involved. So if you come to see a naturopathic doctor, we'll do a full initial consultation, we'll dig deep, we'll dive in, find out more about your overall health, possibly test all of the different levels of thyroid hormone, including the antibodies, and then come up with a treatment plan that's not just looking at the thyroid and thyroid replacement, that's a piece of it, but taking an overall picture at your health, including the immune system. So that's the approach that I recommend when looking at treatment of thyroid conditions.